Per Exam 2026 Canadian Practical Nurse Practice Test and Review 35 Most Asked Questions. Question 1. A practical nurse, PN, is caring for a group of patients. Which patient should be assessed first? A patient with a scheduled dressing change. A patient complaining of sudden shortness of breath. A patient requesting a pain medication for a chronic headache. A patient ready for discharge instructions. Using the ABC, airway, breathing, circulation, priority framework, sudden shortness of breath is a life-threatening priority. Question 2. The PN is unsure about a medication dosage ordered by a physician. What is the most appropriate action? Administer the dose as written. Ask a colleague if it looks correct. Contact the prescribing physician for clarification. Search the internet for common dosages. Nurses are legally and professionally responsible for clarifying any unclear or potentially unsafe orders with the prescriber. Question 3. What is the primary purpose of informed consent? To protect the hospital from lawsuits. To ensure the patient understands the risks and benefits of a procedure. To document the patient's vital signs. To allow the doctor to perform any procedure they want. Informed consent is a process ensuring the patient is fully informed before agreeing to treatment. Question 4. A patient with a C. diff infection is on contact precautions. Which PPE is required? Mask and goggles only. Gown and gloves. N95 respirator. No PPE is needed if not touching the patient. Contact precautions for C. diff require a gown and gloves to prevent transmission via touch/surfaces. Question 5. Which manifestation in a patient with liver failure should the PN report immediately? Yellowing of the eyes, jaundice, decreased level of consciousness, confusion, loss of appetite, spider angiomas. Confusion indicates hepatic encephalopathy, a serious complication of liver failure that can lead to coma. Question 6. A PN is teaching a client about a low-sodium diet. Which food should the client avoid? Fresh fruits, canned soups and processed meats, steamed vegetables, brown rice. Processed and canned foods are typically very high in sodium, salt. Question 7. When performing hand hygiene with an alcohol-based hand rub, the PN should rub hands until 30 seconds have passed. Hands are visibly clean. The product is completely dry. The nurse reaches the patient's room. Effective use of hand rub requires rubbing all surfaces until the hands are dry. Question 8. What is the first step in the nursing process? Implementation, planning, assessment, evaluation. Assessment, data collection, is always the first step to determine the patient's status and needs. Question 9. A patient with a history of falls is found on the floor. What is the PN's first action? Call the family. Assess the patient for injuries and check vital signs. Help the patient back into bed. Complete an incident report. The priority is to assess the patient's immediate condition before moving them or performing documentation. Question 10. Which ethical principle involves being truthful and honest with patients? Autonomy, beneficence, veracity, justice. Veracity is the obligation to tell the truth. Question 11. A PN is caring for a patient post-abdominal surgery. Which sign suggests a possible wound infection? Serosanguinous drainage on the dressing. Pain at the incision site controlled by meds. Purulent, yellow/green, drainage and foul odor. Incision edges that are approximated. Purulent drainage and foul odor are classic signs of infection. Question 12. Which route of medication administration provides the fastest systemic effect? Oral, subcutaneous, intravenous, transdermal. Four medications enter the bloodstream directly and act almost immediately. Question 13. A PN observes an unregulated health worker, UHW, performing a task incorrectly. What should the PN do? Ignore it if the patient isn't hurt. Intervene immediately and provide corrective guidance. Report it to the manager at the end of the week. Tell the patient the UHW is incompetent. The PN is responsible for the supervision and safety of tasks delegated to unregulated staff. Question 14. Which position is best for a patient experiencing difficulty breathing? Supine, flat on back. Prone, on stomach. Highfallers, sitting up. Trendelenburg. Highfallers allows for maximum lung expansion. Question 15. What is the primary goal of palliative care? To cure the underlying disease. To provide comfort and improve quality of life for those with life-limiting illness. To hasten the dying process. To perform aggressive surgeries. Palliative care focuses on symptom management and quality of life rather than a cure. Question 16. A PN is measuring a patient's pulse and notes it is irregular. What is the next step? Check the other wrist. Measure the apical pulse for a full minute. Document normal pulse. Stop the assessment. If a peripheral pulse is irregular, the apical pulse, at the heart, should be counted for a full 60 seconds for accuracy. Question 17. Which of the following is a symptom of hypoglycemia? Extreme thirst and dry mouth, shakiness, sweating, and confusion, fruity smelling breath, deep, rapid breathing. Hypoglycemia, low blood sugar, presents with cool and clammy skin, tremors, and altered mental status. Question 18. The duty of care in nursing refers to working only 8 hours a day, the legal obligation to provide a reasonable standard of care, making sure the patient is happy, following every request of the family. Duty of care is the responsibility to act in a way that avoids harm and meets professional standards. Question 19. What is the correct procedure for drawing up NPH and regular insulin in the same syringe? Regular, clear, then NPH, cloudy. NPH, cloudy, then regular, clear. It doesn't matter. They should never be mixed. Remember clear before cloudy to avoid contaminating the clear insulin with the long-acting cloudy insulin. Question 20. Which nursing action demonstrates patient advocacy? Telling a patient they must take their medication. Ensuring a patient's wish to refuse a treatment is communicated to the doctor. Ignoring a patient's complaint. Discussing a patient's case in the cafeteria. Advocacy involves supporting the patient's rights and ensuring their voice is heard in the healthcare system.